So you can see there's a lot of variation in terms of how burnout is characterized and operationalized across these studies. That's what we found.
What we did find was that there is no relationship between breast cancer and breast pain.
People had concerns about how to write to a complete stranger and also how much information they want to disclose.
What we found is that prescribing of any anxiolytic medication increased really quite substantially.
Now, this is something that's relatively new, and one of the most exciting things about it is it completely changes how cervical screening is done, that a woman could actually take her own cervical screening test.
What we found was that patients who were able to see the same GP frequently had almost 60% less chances of being incontinent, 35% less chances of developing delirium the next year, and they were also 10% less likely to be admitted to hospital with an emergency.
It's so important because it doesn't just affect doctors and their well-being, but it's also how, the infrastructure of the health system is based on doctors being available and doctors being well.
We found out why GPs very rarely use video and why they abandoned it.
We performed an observational study which showed that more than half of PPI users seem to have an inappropriate indication at initiation of PPI therapy, and the leading cause for this seems to be unnecessary ulcer prophylaxis.
Neither can it identify children that are seriously ill, but it also can't identify children that are not seriously ill.
As Amy says, we've shown that the traffic light tool can't accurately identify those children with serious illness, and so GPs shouldn't rely on this to make their clinical decisions.